Kathy Tschiegg. I'm the founder and executive director of CAMO USA and the international director for CAMO Honduras. The story starts pretty humbly. I was a nurse. I trained to be a nurse. I always wanted to be a nurse as a kid. And I decided to work a year. And during that year, I thought to myself, well, you know, I want to do more. Maybe I want to become a missionary or want to do something more. And so at that time, what I did is I started just kind of looking through my church and that, and there was nothing as a nurse that really stuck out to me. But then before I was going on an afternoon shift one day, I saw the TV, the toughest job you'll ever love, Peace Corps. And at that point I said, okay, well, let me call. And 1 month later, I found myself in a foreign country with no Spanish, not knowing how to speak Spanish. And that was a really difficult thing for me because as a kid, I had a speech impediment. So I was bullied because of, in my elementary years and that. And so learning a second language was just a real challenge for me. And, but I did. And I became a nurse, and I was given, in Peace Corps, you're given a 3-month insight visits, or 3-month training where you have insight visits. And at that time I was given 3 insight visits, one in Donley, one in Trujillo, and one in Santa Rosa. Well, Donley was a first, and I came from a very small community in Ohio, and just very Anglo-Saxon and Mennonite. So Donley kind of felt like that. And then also I was a triathlete, so Taylor had the front of the beach and everything, so it was great. I could go swimming. And then the next trip was at that time it was a long bus ride, 12-hour ride to Santa Rosa, mudslidden roads, in minivans that had pigs tied to the roof and chickens and moms breastfeeding, and so sweaty, no air conditioning. So we finally get to Santa Rosa, or I get to Santa Rosa, and I go to the site that I'm supposed to visit, which is the Hospital de Occidente. And when I swing the doors open, the smell of staph and strep hits me. There's a vulture on the cross, and I'm saying like, oh God, please not here. And sure enough, I went back for the training in the capital in Tegucigalpa, and 2 weeks later I get an envelope, and the envelope says Santa Rosa de Copan, Hospital de Occidente. At that point I said, okay, a commitment is a commitment, a promise is a promise. And I came out here, and I was at one of the supervising nurses. At that time, there were only 4 nurses. And the other nurse was Kathy Burns, and she had men's medical and men's surgical. I had women's surgical and women's medical. And then Cecilia had lactantes pediatrics, and Gladys had maternity and ER and OR. And then Kathy covered emergency room too, the other Kathy. So here we were, 4 nurses, having to take care of 210 beds, and many times we had 2 people per bed, and it was a journey, an incredible journey for 2 years, and we saw incredible amount of unnecessary deaths. We would ration tape, we would ration toilet paper. We get so much tape per week, so much toilet paper per week, so many supplies per week. And you would just do everything that you possibly could to save the patient. I remember one night in particular, I had a woman who just had surgery, and she was going into arrhythmias, and I didn't have a monitor or anything, but I kept my stethoscope to her chest because she'd go into VTAC. She'd lose consciousness, and we would bolus her with the appropriate drugs and do the precardial thump, and she'd come back. And so I remember I was with her for 23 hours with my stethoscope to my ears until my ears were bleeding. And finally I had to walk away. She died. So, sorry.
Take a second.
This repeated. These things of incredible death that were not unnecessary for 2 years. And things that you knew as a nurse what to do, how to do it, how to save the life, You knew what to do. And there were no tools to do it with. And so my last month, we worked on a nursing procedure book in the evening, and we were in charge of other nurses. And Kathy and I and Gladys Castellanos worked on a policy procedure book and installed that and trained the nurses to do that. So we did what we could with getting the literature and the education to them, but still we didn't have the tools. So my last month I decided, okay, I'm going to count how many babies we carried in the morgue. And it wasn't really intentional. What it was is we were called to a ward, and a mother was weeping, and a baby had died, and I was left with the task of carrying that baby to the morgue. And when I did that, I started counting how many babies under the age of 4 that we carried to the morgue. And we had carried more than 31 babies that month to the morgue due to not having ventilators, not having machines, not having any resources whatsoever, and not even having the appropriate drugs. And so when I went back to the United States, I said, I am done with this godforsaken place. I never want to return here again, and I never want to be in the situation as a nurse of not having the tools and equipment. So I threw myself into critical care nursing and was on a team of stabilizing open heart patients in 1981, and was very happy with being able to do that, and felt like I could forget Honduras, and was really attempting not to remember Honduras. But I would have these reoccurring dreams, and the dreams would be that I'd be in my USA sports car traveling the road here in Honduras, and the only thing that would change in my dream is when I pulled up at the hospital and would go in the hospital, where I'd wake up. Sometimes in laundry, sometimes in the kitchen, sometimes in the morgue, sometimes in my ward, and it would just be random. And then also I would see the eyes of my patients in critical care. I would see the faces of the patients that I had lost in their eyes. And so it was one of those things that I tolerated those reoccurring dreams from 1981 till 89. And then I said, okay, God, I get it. I'm a stubborn Swiss woman. Apparently you're trying to tell me something. And so I came back. And when I came back, the conditions were worse, and it brought me to my knees. And at that point I thought, well, you know, you can go on life and you can blame others for the conditions. You can blame politicians. You can blame your parents. You can blame, you know, somebody that you're angry with. You can put the blame on everyone and everything. But the bottom line is, if you're given the gift and talent to do something and you don't apply it, then you're not doing your part. And that was very, very clear to me at that moment. So when I went back to the States, I said, what were the reasons as a nurse that I couldn't accomplish things? And I felt that I really needed to have a business degree too. So I went back, completed the business degree, and during that I wrote the model of the things that I saw wrong with short-term missions, and that there was no continuity, there was no plan, there was no follow-up, and they left devastation behind them that they never even knew about because they didn't have the follow-up, and they didn't have the relationships that they needed. And there were teams coming down for 20 years that come back and do the same thing year after year without any change, because they're doing the same thing without a plan. So I said, no, the model of CAMO is going to be different. And so we started with much the same model as Peace Corps, where you have a counterpart, you have a partner. So you partner a professional with a professional, but we did it short term. But we did it short term with a long-term vision. So anybody who joined CAMO had to commit to a 5-year period to be the mentor to the person down here. Now, what is included in that? Getting supplies, getting material with the education and everything. Because it doesn't pay to become a critical care nurse or an ER nurse or a NICU nurse or a neurosurgeon or an ophthalmologist if you don't have the surgical microscopes to do the surgery, you don't have the lens implants, you don't have, you know, the ventilators for the babies, you don't have that. So it was a combination of putting the structure together to get equipment and materials donated in an organized way, and then getting the professionals needed in an organized way, and getting the counterpart in Honduras who really wanted to be a champion, and champion those people with the people in the USA that were committed. And so today, that strategy has taken us to, and that strategy is you're meeting the need of the Honduran people. You're not meeting the need of the American who wants to come down here. This isn't a feel-good project for the Americans who want to come down. This is all about what is needed here in this country. And so, you know, with that, that's number one. Number two, you got to have a plan. Number three, you got to have follow-up. And number four, you got to have accountability. And number five, you got to have sustainability. So those are the 5 components of our model. So with that, we're going to fast forward. So that was the initial thing. We followed that strategy the whole time. We're 26 years old now. And today, this is how we look. Today, we have now 21 programs. Those 21 programs last year provided 162,000 services to the people in this region. Those are medical and educational programs. So just for example, in the American Heart Association chapter that we have down here, we are the only licensed organization in Honduras to certify people in the American Heart Association regulations of certifying people. And last year we certified over 1,200 doctors and nurses. And so we continue to do that training, and we will continue to expand that. But now, before it was all done by American people coming down as instructors, and now it's all Hondurans doing it. They're producing that 1,200. It's not Americans, they're doing it for them. And so they have ownership of that. That's one example of the educational. The other thing that we have is a literacy program that we have 13 schools. They're the poor schools, but now those 13 schools all have libraries and they have textbooks, and we're working with the teachers and getting them up to date on thing. The textbooks we couldn't buy for every single student, but at least we bought samples for each class, for each subject matter. So that will bring that up, because illiteracy in Honduras is at 43%. And so we need to attack that in order to bring this nation up to where they need to be and make people employable. The other thing that we do is the medical services, and there are 18 out of those 21, 3 are educational and 18 are medical. So in the medical services alone, just dentally, we have Honduran brigades that go out 2 days a week to the rural villages treating the children. And last year that treated over 9,000 children. And that was not extractions, that was curative care and making sure they didn't lose their teeth, teaching them how to care for their teeth, and trying to get them to save their secondary teeth instead of pulling those secondary teeth. So that's just one idea. And then eye surgery, we're doing eye surgery, over 480 eye surgeries a year, and then also neurosurgery for all the traumas coming in, and then we have a mammography program, a women's health program, cervical cancer, x-ray programs, ultrasound. We have 5 remote ultrasound prenatal programs. So I'm just touching the tip of the iceberg, but all those programs had counterparts that got them to the point where they were able to sustain themselves. So it isn't about the American coming down and doing it, it's about empowering them with tools and filling those gaps so they're able to do that. So then also what happened in 2004 is the community started coming to me. So I've talked about education and medical services. But what started happening was the community saw that we were here and that we were present and that we weren't going anywhere, and that I, as a North American, was committed to this. Now, by commitment, I mean commitment. You dedicate your life to this. You can't be having if to do it well, I'm not married and I've not had any children because I've been dedicated to doing this. And it is a 16-hour a day job doing this. But it has great rewards. And so in 2004, because of that reputation of being diligent and everything, the community asked me, hey, we have an abandoned trade school. Can you help with the trade school? Okay, let me see. Reformed the board, got new leadership, and that trade school 2 years later was producing 600 students a year. And so we helped to remodel, bring the tools, the equipment in, get the teachers in and all that. Then, and soon after that, the mayor of the city came to me and said, domestic violence, Kath, can you help me with domestic violence? So we took 3 years to research that, started working with the police, the judicial system, family court, human rights, police department, and we started working with them to socialize the issue of domestic violence. And we built the largest women's shelter in Central America now. It has 44 beds, and it's a model. It has a full psychology, social worker, housing, and then also has outpatient service for those women. And we connected it to the trade school because a lot of the women are economically dependent upon their husbands. So we connected it to trade schools so that there was that opportunity that they could get some education. Then the daycare center came to me and said we didn't have food and we don't have a teacher, and it was public daycare. So we went into that and we provide a full-time teacher, food, and we helped. There was black mold, no screens. And you know, CAMO isn't an organization. You're not going to see these kids with flies on their face, and you know, I'm not going to sensationalize children. And so, you know, that's probably been my fault in marketing, but most of the agencies do that, and I won't do that. I'll show you a smiling kid, and he's smiling because we're there. And I think that's what people need to see is the impact that we're having. So those children are well fed, and the children that are very poor that come in, that are malnourished, we have a nutritional program that sees those children and makes nutritional recommendations, and then we do supplements for those kind of things. So that's the kind of the daycare that we help with that. Then the community came to me and said, listen, we have this brick building that no roof or anything's been put on it. We'll get the roof on, but it's mud inside. Can you help us with the other things? And that's a community center. That's a gym. It is the largest gym now in Honduras. It's the nicest public gym in Honduras. And they do all the basketball tournaments and all the soccer tournaments, public tournaments out of this. And now it has 500 children and adults coming to it every day. And it's totally sustainable through memberships of the weightlifting area and the ads that we run. So that's creating a revenue, and that revenue is completely sustainable. And we pulled it out from city government, and we made an association so that that money could never be taken away from that entity. So, and then also we helped to develop the cultural center, and that we helped to build that building and put money in that, and now that's turned over to that commission of the city runs that. And then we also built the second largest public health center in Central America, and that is providing over 500 services a day now in that public health center. And then the hospital, we put in infrastructure. You know, there was no generator, so we put in a $250,000 generator. There was no communication system, so we put a telephone system. There was no compressed air to run the ventilators and save these babies, so we put the generators in. And many times that's what organizations don't look at, is the infrastructure that you need to support your equipment. So also when we put that infrastructure in, we also nabbed one of the first graduating biomedical engineers to work full-time for us, because it doesn't pay to pay for a $30,000 piece of equipment. When a fuse goes bad, it goes to the junkyard, because nobody's here to tell you the fuse went bad. So there's a lot of background things that we've done in the back to make CAMO a very successful program. And it is replicable, but whoever does it needs to do it very logistically and have a developmental plan and include the buy-in. You can't come down as an American or as any citizen of any nation and come down and say, oh, you know, you got to do it this way and this is what you need. And no, it has to come from the people that you are serving. And those people have to say to you, we need this. And then you need to say to them, do you really need the limousine when really what you need is a bicycle? And so there is some temperance there that you have to do with those needs. So you have to be there, and you have to be cognitive of their culture and that, and give them what they truly need. That's number one. And number two, you have to really be careful about selecting your champions, because some people are in it for themselves, and that will fail. It's the champions that are in it for the good of the better of the majority is the successful stories that we've had. And those are the key elements that I would say that you need if you ever want to duplicate CAMO or duplicate what we've done. That's what you need to do, and always be compassionate to the patient, and compassionate and always be grateful for the things we've been given. If you look at our model, so you take the daycare, you take the kid off the street that would be begging on the street with a mom that has no wages. then at, you know, age 13, you get them into a trade school because they don't want to go to college. They want to learn a trade. And so you get them in a trade school. And you get them off the street. You have 500 kids playing in a gym instead of causing trouble on the street.
Right.
So you have that. And then at that point, you have infrastructure for domestic violence, and you have art too, because some children like art and some like sports. So you get healthy activities in the community. Santa Rosa has been named the safest city in Central America. I think that structure and that logic of working with the city government and the commission and having good relationships with them has had an impact on that. And if you look at people who have joined the caravan, the people who joined the caravan aren't the people, there's a low percentage that has come from Santa Rosa. I think that the major thing that people don't really talk about are the miracles that walk in front of us all the time. I mean, you can have a good plan, but when you're really doing what you're supposed to be doing, things fall into place. And for instance, when we outgrew the container that we were working from, I get a random phone call saying that a man that was in Peace Corps and he has a friend with money, and that the story ended there with $250,000 given to build this building at the time that needed. The land was donated. I was at a party, and the man who donated, Dr. Rendon, his son knew me when I was in Peace Corps, and his son died of leukemia. And he started talking how his son remembered me, et cetera, and he said, is there something we can do? Can we build a statue for you or something in recognition of everything? And I said, no. He goes, well, what do you really need? And I said, I need land. He goes, here's land, I'll donate it to you in front of the hospital. And the land that we're sitting on was donated to us. So if you're really doing it for altruistic reasons, I believe that there is a God and there are no coincidences, that things happen for a reason, and they happen in the order that they happen for a reason, as long as you stay the path, as long as you keep working the path and keep yourself grounded.